يلا بسم الله والصلاة والسلام على رسول الله ولا حول ولا قوة إلا بالله العلي العظيم. اللهم ما سهل إلا ما جعلته سهلا وإنك إن شئت جعلت الحزن سهلا. هنبدأ مع بعض محاضرة ميديكال بريزنتيشن للميديكال تيم معانا هنا. أول حاجة إن إحنا هنبدأ أول محاضرة أو أول سلايد إن إحنا بنشرح فيها الميديكال بريزنتيشن اللي هنقدمه النهاردة. هو عبارة عن إيه؟ تمام، اللي هو السلايدز نفسها فيرست وسكند وثيرد وهكذا. وايه الهدف منه؟ الهدف من الميديكال بريزنتيشن ان احنا طبعا نسهل الموضوع كيفيه الممارسه الطبيه مع المرضى وعلاج المرضى، وكل الهدف من الموضوع ده ان احنا تايم مانجمنت، ان احنا اهم شيء بالنسبه للامور دي ازاي ان احنا نستغل الوقت الامثل في علاج المرضى. تمام، هنبدأ السلايد الثانية. أول حاجة الفيرست بيزك برنسبلز اوف هاندلينج بيشنتس أو بيشنت هاندلينج. طبعا من الأولويات إن إحنا زي ما إحنا شايفين أول شيء إن إحنا كالمنس أند سيتويشن كنترول، إن أنت تهدي العيان وإن أنت تعرف تسيطر على الموقف. بالنسبة للحالات الطوارئ بالذات طبعا العيان بيبقى منزعج جدا، وكل المشاكل بالنسبه له اذا كانت مشاكل بسيطه simple or moderate or severe problems هي بالنسبه له يعني life or death. فانا my mission is to calm the patient situation، وان انا اهديه عشان ان هو الوظائف الحيويه بتاعته ومعدل ضربات القلب ما تزيدش، وفي نفس الوقت ان انا نفسي اعرف اعمل كنترول واعرف ان انا ask from the relatives or الناس اللي هم جايين مع العيان ان هم يحاولوا ان هم يقعدوا في الانتظار لغايه ما نعرف ان احنا نعمل assessment للبيشنت how and we will deal with him. اول جمله any emergency equal first step is calmness not chaotic speed. يعني انت لو انت اتوترت، يعني لو انت كنت نيرفس تمام، او ان انت اشتغلت بسرعه، او ان انت you reacted with the patient feeling، يعني definitely you will not be exact right to manage this patient. So calm the patient and in return you will have to you gain to how to gain to control this patient by calmness of the patient. Control tone of voice and body language. طبعا these things you will gain by experience, by time. If you shout to the patient or use some special tone, يعني weak or loud tone, this will affect the patient and also body language, because the patient can sense you by his sense and can sense your experience in dealing with these situations. So make your voice effective and you will you will feel yourself that you are confident and can control the situation by mild voice, not so hard or to raise the voice or to be nervous. This will make negative negative feedback for the patient. Patients and their families again confident from a calm team. This is confirmation of things we have talked about. دي الحاجات اللي احنا اتكلمنا فيها. يبقى اول خطوه ان احنا نهدي العيان، وان احنا نعرف ان العيان بيقيس جوده الصوت بتاعتك والصون والبادي لانجوج بتاعتك وبيحسك. فانت لازم تكون كونفيدنت لما بتتعامل مع المريض، وما تحاولش تتفاعل معاه، وتحاول تسيطر على الموقف وتكون هادي الاعصاب عشان تعرف ان انت تسيطر على العيان وتعرف ان انت تعمله جود مانجمنت. الجولدن رول: if the team panics the situation worsen even it is simple. وده طبعا تأكيد على الكلام اللي احنا بنقوله. لو الفريق الطبي انزعج يعني ده بيبقى اثره مش كويس مع العيان. طيب السلايد الثانيه second work organization inside the clinic. دلوقتي داخل العياده الطبيه في حاجات تنظيمات او حاجات organization، في حاجات منظمه will arranged inside the clinic itself. ايه هي الحاجات دي؟ what is these things؟ one clear role، توزيع، clear role distribution. everyone has a role from the reception، تمام، reception nurse، preparation nurse، emergency nurse، documentation personnel. طبعا we don't have so much this nurses, but this is applied to the big facilities of hospitals like multidisciplinary or hospital. So they have preparation nurse and reception nurse. Everyone knows exactly what is his role. Documentation, this is according to the work itself. Yani there is documentation nurse, it will register everything in medical terms and with timing, and there is registration personnel, this is outside on the reception when they first receive the patient to collect the information. الايتم الثاني second item في the work organization inside the clinic, simple triage system. We are applying here and we have established here simple triage system and one room, and this is very important to triage the patients and see the vital data. So we can categorize this patient to main 3 categories according to triage system, and this triage system should be done by a well-trained nurse. So critical case, we refer to this case to the red zone, to area A zone. This is needs immediate attention and interference within from 0 to 10 minutes. This is according to special cases like trauma cases, like burn cases, like acute injury cases, wounds, active bleeding cases, comatose cases. This is critical cases or category A cases. And moderate cases, this case is moderate. You can take action between 15 to 30 minutes to these cases according to triage system. And the mild cases, they can wait up to 2 hours in the waiting area. So this triage system is very benefit to categorize and to triage the patients to the different definite area and the timing and when you should interfere with this patient. And this is applied in the advanced hospitals, and they apply these systems, for example, like the Australian scale applied in some hospitals. Slide الثالثة, third slide, medical documentation. This slide is very important and highly important actually. So for me, I am very concerned about the medical documentation and records of the patients. Record arrival time accurately. You register everything, or the definite personnel will do this job. Document chief complaint. This is we have so many talking about these items. So the complaint of the patient, we are writing on the patient own words, not in medical terms. And for example, the patient is having abdominal colic. We are not saying, for example, in the complaint the patient has renal colic. No, renal colic, this is medical expression. So we will write the complaint on the patient own word. For example, the patient is complaining of fever. Okay, he is complaining of fever or anything according to the patient own words. Record vital signs immediately, and this is done before, we mentioned in the previous slide, second slide. And the blood pressure, pulse, temperature, respiratory rate, level of consciousness. This is very important items we have to do with all patients. Not allowed to relying on memory. Every time you document, you have a paper and a pen and document everything. When you are going to make vital data for the patient or triage the patient, write everything with your pen in your hand and on a paper, not to remember or relying on memory. Delaying documentation, this is unacceptable and forbidden. Don't do this. Don't delay documentation, because you have to register everything with timing. Anything not documented equals didn't happen. This is the example of this slide. If you didn't document or register everything, this situation not happens. You cannot get it again, or you cannot have it again. Fourth slide, call communication and communication system. Maintain clear contact list for all staff. This is very important also, because sometimes we have to call all the team when there is mass treatment and we are facing not only one case. So as the general rule, we are calling for help and calling all the team to share the work with us when we are facing more than one patient. Define the status, and we have also code we are saying in these situations, like for example blue code, when to call the doctor immediately. There's cases you should call the doctor when you need help exactly at this moment from the doctor. When to request additional support if your facility cannot handle the situation with a number of cases more than you handle by the number of the medical team, or special cases need special places and documents and special equipments and investigations and etc. For example, some patients need ICU or some devices or anything. So at this moment you have to decide to additional support. Examples requiring immediate escalation. This is loss of consciousness, chest pain, severe bleeding, difficulty of breathing. So this is highly important complaints of the patient or medical cases and emergency cases. So you have to concern about these cases. He is giving these cases as high red cases. We should recall all the team, or we should recall the doctor. We should seek help. All the steps we are mentioned before in this slide. So these cases is severe cases or serious cases. We have to invest the time and don't wait and don't waste the time to deal with these cases. This slide is talking about important item about appearance and clinic organization. So for us all as a medical team and medical staff, we should appear in the best shape of us. So we should clean and we should be care about our cleanness according to the uniform and professional uniform at all the time. So the patient will feel that you are very good, you are shining. Organized workplace, emergency tools ready. So even this item is very important, so you don't waste the time in handling the patient. Everything is available in its place, and at the emergency situation you will not lose the time to search for the important items you are dealing with, either cannula or anything you are using with this patient, or IV fluids or gloves or anything you are using to protect yourself. So everything should be available and appear, so we will not lose the time with the patient at this moment. Emergency bed always prepared. This is also very important, and all emergency staff know this and think. So also you don't waste the time, and this will give positive feedback for the patients. First impressions equals trust or fear. So this is a very good example. So the patients, he will take first impression. First impressions last. Either the patient will trust you or fear from you to handle this situation. Situation containment, de-escalation. Situation containment also try to contain this situation with calm, like we talked before. Deal calmly with patient relatives. We said about this, and we talked about this previously. Avoid argument. So this all under don't waste the time. Avoid argument with things not related, or don't waste your time when you are focusing with the patient. Reassure the patient with simple phrases. Okay, and we are here with you. Try to give the patient some sweet words to make him calm, because at any way you should make him calm so you can handle this patient. The situation is under control. All these words are very good for the patient actually. So now this slide is very important. We are now starting steps in managing critical emergencies. So every one of us, especially medical staff, they have studied and they have a license with basic life support. So this slide describes the action ABC approach. We are using this principle. In some cases, before we apply ABC, take care about cervical spine injury. So, and also protect yourself if you are going to manage one patient outside and there is some danger around this patient, like for example raining or water or electricity or on the high road. So first protect yourself, يعني stand in a safe place because not to be injured yourself, and try to pull the patient to a safe place from danger. If there is, for example, water or electricity or anything, and start the steps. So second thing, care about cervical spine injury. If you are in doubt that this patient in a motor car accident or motorcycle car accident, so you should doubt this patient have cervical spine, so put for him the heart cooler. And this is very important in this situation. Then you will apply the ABC. ABC airway. Make sure that the airway is open. Is the patient is breathing or not? All of us know this. Listen and feel, and observe. If there is obstruction in the airway, the airway should be open. This is the first step of management. Second, B refers to breathing, respiratory rate, signs of distress or cyanosis. We will give the patient oxygen after we make sure that the airway is open. And C, circulation. We will measure the pulse, check the pulse, either peripheral pulse, the radial pulse, or next to the neck, side of the neck. This is the carotid pulse. Blood pressure, and care about bleeding. If there is bleeding, you should control bleeding at this situation. Practical steps, rapid assessment, call for help immediately, prepare the equipment, document everything, continue monitoring. Okay, so after these steps, we talk about applying steps in managing critical patients. We want to mention one thing important. So after you will secure yourself and make sure that you exclude cervical spine injury. Third thing, immediately you ask for help, because if you observe one patient in emergency, you cannot deal with him alone. So inform the local authorities and call for help, and then you will step into these steps as you all of us we have learned and trained about the basic life support. So rapid assessment, call for help immediately, prepare equipment, document everything, continuous monitoring. So there is key questions to ask the patient. The presenting complaint. What is the main problem? Not problem happens with the patient with long time. No, this is the coming complaint. For example, there is one patient is a chronic diabetic or chronic hypertensive patient. This is not the presenting complaint. So what you should ask yourself, what bring the patient came today? Of course, I know he is chronic hypertensive or diabetic, but what makes him come to me today at this moment? This is very important. When did it start? So I will analyze the complaint and the presenting complaint of the patient, when this happens, how severe it is mild or moderate or severe, and then we will step to the medical history, any chronic disease you are treating, have been treating of, for example, diabetes, hypertension, heart disease, bronchial asthma. You are taking any medication, any allergies. Okay, in emergencies, any loss of consciousness, chest pain, breathing difficulty, and bleeding. You should care about these items very carefully in handling the emergency patients. So this slides, we are saying important things, common mistakes to avoid. And also we mentioned, and we talked previously in previous slides about this, rushing without proper assessment. Don't rush to take your decision in giving the patient proper or certain drug or certain maneuver, or to take action, or to take a decision about this patient. Take your time. Ignoring vital signs, this is very common and mistake. Don't do it. Poor team communication, yani all the time, whatever happening, you should be work with team, and should be with good communication. Disorganized workflow. So these things are very important, and it is common mistakes, and you should avoid these things to happen. Final message to the team: every team member matters. We are all following the same principle to concern and treat the patient. So every one of us is important. No one important more than the other, or no one is less important than the other. So every team member matters. Organization is more important than speed. So you should care about the organization you are working in. Safety, always comes safety, and this we talk also about. You should secure yourself, especially when dealing with patients outside the facility. The patient is not a number, it is a responsibility, and this word is very, very good. So this is a pushing factor that you will care more about the patient. Also, safety always comes first, and this is also coming from everything we are talking about previously, with documentation and dealing with the patient and teamwork and timing and everything. This phrase is describing this item. So I am giving you some focused high yields topic that it will help you. So everyone should read and should talk with him and imagine these situations and these cases that one time he will face. So these readings will help you in continuous medical education and learning, and invest your time all the time, because to make your brain all the time fresh to deal with the situations, and you will be ready. Basic life support, CPR, adult and pediatric CPR basics, use of AED, recognition of cardiac arrest. This is non-negotiable. Everyone should do this and will be trained with this. Every nurse must be confident, not just familiar. Airway and breathing emergency, acute asthmatic attack, COPD, exacerbation, upper airway obstruction, oxygen therapy basics, cardiovascular emergency, acute coronary syndrome, chest pain approach, hypertensive emergency, shock types and early recognition. Focus on early warning signs, not advanced cardiology. Okay, start with simple things. Don't go rapidly to the advanced. Neurological emergencies, we will read about stroke recognition, fast approach, seizure management, altered level of consciousness, diabetic emergencies, hypoglycemia, most common and dangerous in the clinic. Hyperglycemia, DKA basics. Nurses should act before lab confirmation in hypoglycemia. This is very good, because hypoglycemia actually, especially in diabetic patients type 1 receiving insulin, this is a killer and simple to cure in a few seconds. So like the computer, it will shut down. If the brain, if he didn't find glucose, he will shut down like the computer. So you will not lose anything if you, for example, one patient coming with coma, if you give him glucose, if this coma underlying cause hypoglycemia, so at this time you will save the life of this patient, and this is very, very important item. So don't wait for the lab confirmation about this patient to know what is the underlying cause of coma. Act immediately. If there is coma patient and you cannot differentiate, this is from hyperglycemia or hypoglycemia, so you give this patient glucose 25% or 10% if he is in deep coma and he cannot swallow. So at this moment you will save life of the patient, especially if this patient is coming alone with no information that detect that he is diabetic patient type 1 and receiving insulin. Trauma and bleeding control, primary survey, ABCD concept that we are following, external bleeding control, fractures, immobilization basics. 7, anaphylaxis and allergic reactions, early recognition, immediate action steps, monitoring after stabilization. 8, poisoning and drug overdose, basic awareness, initial assessment, when to escalate immediately. Infection control and sepsis awareness, early signs of sepsis. This is a very highly important issue. Proper PPE use and isolation basics. This is to protect yourself and your team to be infected, and also we have lost a lot of medical members because they don't apply this item and this subject. 10, documentation and medical legal awareness, accurate charting, incident reporting, consent basics, that's actually save patients in clinic settings. Okay, thank you my friends for attending this lecture, and if you have any questions to ask, so I will be glad to answer, inshallah.